important points regarding the myocardial infarctions, their types specifically. And this kind of the questions are asked multiple times in Fmge and in Neet PG also, right? So first of all, there are the different kinds of the AMI on the basis of the involvement of the different kinds of the arteries and the ECG leads. So we can get to see, for example, the inferior AMI. You can also get to see in terms of the anterior AMI, or we can also get to see in terms of the lateral all AMI, right? And also the combinations, for example, the anterior inferior, anterior lateral all AMI, right? And there is on conditions, for example, if we get to see the case of the inferior or AMI, for example, if there is a segment elevation in lead number 2, 3 and AVF, there is the chance to develop the inferior or the posterior all AMI, okay. And there can also be we can also get to see there is the development of the right ventricular failure. As a result, the hypovolemic shock that can also be seen. So in this case, we can also give the IV fluid, okay. This is the question that was asked in the previous year. And as far as the different kind of the ECG leads are concerned, for example, if we get to see that lead number V2 and V1 and V2, the staging elevation, then there can be the septal all AMI, interventricular septum. And for example, if we see the V2 to V4, V2, V3, V4 here, if we get to see the staging elevation, then that can also define the anterior all AMI, right? And if we see, for example, there is a V5, V6 and furthermore that defines the lateral all AMI, right? So these are the different kinds of the ECG leads and the types of the myocardial infarctions on the basis of the leads. And another important thing, as far as the treatment is concerned, this